This video will show you how to take a vaginal swab. Start by washing your hands with soap and water. Dry your hands on a clean towel. Open the contents of the kit on a clean surface. Twist and pull the red cap off the plastic tube, but keep the swab inside the plastic tube for now. Get in a position that allows you to comfortably access your vagina. This may be with one foot on the toilet lid or the edge of a bathtub. Take the swab out of the plastic tube and hold it firmly with your fingers on the red line, about halfway along the swab. Slowly insert the soft tip of the swab 3 to 4 centimetres into your vagina. This is about where the swab becomes thinner. Gently rotate the swab as you insert. Then rotate 5 to 10 times around the inside of your vagina. There should be no pain or discomfort. Remove the swab and place it back into the plastic tube. Push the red cap in place until you feel it click securely. Wash and dry your hands again. Place the swab back into the cardboard box. Write your details on the form inside the box lid and use the addressed adhesive label to secure the lid closed. Drop your sample off in any Australia Post box. If you haven't been contacted about your results within 2 weeks after posting the test, please phone Melbourne Sexual Health Centre and ask to speak to someone about your recent postal test results.